Welcome to AI for Good, the leading action-oriented global and inclusive United Nations platform on AI. Organized by ITU in partnership with 40 UN sister organizations and co-convened with Switzerland. The goal of AI for Good is to identify practical applications of AI to advance the United Nations Sustainable Development Goals and scale those solutions for global impact. In today's session, we're counting on you to use the live video wall feature to ask questions and post comments to help create an engaging discussion. We encourage you to stay until the end, as we will hold a 30-minute networking session in the neural network. Here you can meet, ask questions to our distinguished speakers, connect, and chat with the AI for Good community. It is now time to kick off the session and welcome our first speaker. The floor is yours.
Hello, everyone. Welcome to the AI for Good Innovation Factory. My name is Josh Choi from the ITU, the International Telecommunication Union. I'm very happy to moderate today's Innovation Factory session. With a brief introduction about the ITU is the United Nations specialized agency for ICTs, and then we are also the organizer of the AI for Good Global Summit in partnership with the 40 UN sister agencies and co-convened with Switzerland. The Innovation Factory is a program launched in 2020 under the flagship initiative AI for Good Global Summit. It originally started as an online pitching platform for startups, and this year it has been upgraded as more like an accelerating program. So we have startups grow and scale their innovative AI solutions to achieve the SDGs by providing various business opportunities and mentoring services and matchmaking with the potential investors and partners, and then some cash prizes, etc. So today's session is the fifth of this year's series. The winner of each session is invited to the grand final at the end of the year. And also through the year, not only the winners, but also the other best teams will be supported to grow and scale up through the help of our partners and startup accelerators and incubators, so that we can trace how the Innovation Factory startups grow and scale and evolve and are making impact. Especially today's session is organized in partnership with IBM Hyperprotect Accelerator, IBM's Startup Accelerating Program, and Village Capital, one of the biggest impact venture capital firm. So we have Mr. Adam Ring, who is the global head of IBM Hyperprotect Accelerator. So Adam, can you tell us about the Hyperprotect Accelerator program and also how the program boosts innovation around the world? So Adam, please go on.
Thank you, Josh. Allow me to share my deck with you all. So I'm here to talk very briefly about IBM Hyperprotect services and our accelerator. Hyperprotect is the safest place for your personal and sensitive data on the public cloud, a perfect match for AI for Good and health tech. I'm Adam Lindsay Gordon Ring. I've had 25 years in startups, 1 unicorn, 3 successes, many failures, and therefore many lessons or what we call scar tissue. I'm now global head of this IBM Accelerator program. I serve on the advisory board at Village Capital in Washington, DC, who are our partners in this accelerator. And I'm vice president at Ivy Plus European Leaders. Now, if you want to hear more about Hyperprotect, come to our Z-Day on September 15, and you can join our community here with that link for alerts. Now, IBM is aligned closely with AI. It's one of our major goals, and health tech and tech for good, of course. And as you can see from this slide, we're very focused on diversity and female-led startups. Now, this is the criteria to qualify for our accelerator, but I would recommend as a data privacy expert, even if you aren't qualified to join the accelerator, I would definitely recommend that the technology for data privacy and security, particularly now that it's quantum safe. I'm personally happy to help anyone, especially in tech for good, which is a real passion point of mine. These are the benefits that we offer through the program with Village Capital and IBM. But the thing that excites me as a startup veteran about our program and why I was interested in it before I joined IBM. No equity. We take no equity. We don't charge any fee. We give you all the help in the world, and it's powered by IBM. So as a founder, that should sound very attractive to you. And it's not exclusive. We don't mind you using multi-cloud, so that there's really no downside. With your data inside the HyperProtect enclave that we provide, in terms of data privacy, if that's a concern of yours, and it should be, you eliminate the technical risk of a data privacy flaw or a security breach. You eliminate the risk of data privacy violations and the bad press and fines that come with it. But also, I would recommend you market yourself as using the strongest protection to respect your users' data. So a pro tip that I learned in my time in startups is that there's a group I call privacy pioneers out there. This is more than 20% of folks out there that will prefer your solution if they authentically believe you respect their data and their privacy with best practices. Now, good luck today. The winner will automatically win a spot in our Friends of HyperProtect program. Applications for this program are open year-round, include all the benefits. This way you can join when it makes sense. So even if you don't win today or you're listening in, please do apply with the link there. And a special shout out to Dr. Sassy for arranging IBM's involvement today, and very happy to be involved with AI for Good and the UN. And she will be one of our respected judges today, so you'll get very good judging. So back to you, Josh.
Thank you very much, Adam, and thanks a lot for all your information about the program. We look forward to more exciting collaborations in the future. All right, okay, so let me introduce also the Ahmed Fadl from Village Capitals. Ahmed is also today's judge. And Ahmed, tell us about also Village Capital's mission and how to help early stage startups scale up their solutions to make a social impact, please.
Perfect. Thank you so much for having us today. This is Ahmed Fadl. I'm talking to you guys from the very sunny Cairo, Egypt. I started my career in the humanitarian development fields, working with Save the Children International and also the UNHCR. And then co-founded a fintech company here in Egypt. And then also after that joined Village Capital. So Village Capital is one of the biggest impact-driven early stage accelerators in the whole world. We've been operating from the US, but like globally for 11 years right now, supporting more than 1,500 companies all over the world. And then this year, 2022, is going to be the fourth year we're doing the HyperProtect Accelerator with IBM. At Village Capital, we care a lot about equity, diversity, and inclusion. For the 100 companies that we supported in the past 3 years, 45% are female founders, 55% are diverse founders. We care a lot about diversity inclusion. This is even in our scorecard for the companies. And then, yeah, we're doing this program with IBM, but we're also doing tens of other programs all over the world, specifically around fintech and health tech. So if you guys are interested in exploring these opportunities, I would say the priority is the IBM program, but then if also interested in exploring other opportunities, it would be great to connect. Again, yeah, thank you. Back to you, Josh.
And thanks, Ahmed. Well, I think that the AI for Good and Village Capital can make a lot of interesting synergies in the future. So we look forward to it. All right. Okay, so we have 3 more judges today. So I'm very happy to have such a great judges today. Firstly, I'm happy to introduce Dr. Melissa Sashi, who has multiple great titles in the tech and startup scene. And so Melissa, tell us about you and then your current work in the field of AI and the startup scene, please.
Yeah, sure. So I'm thankful to be here. I'm Dr. Melissa Sassy. You can find me on Twitter at Mentor Africa with a K. I wear a lot of hats for those of you who know me, and sometimes it's a little bit hard to keep track. I'm an ex-IBMer. I'm actually the founder of the IBM HyperProtect Accelerator. So it's really exciting to see where Adam is, going to take the program. I am also the CEO and co-founder of a future of work startup called Skills Hustle. We just launched it recently, are running through our proof of concept projects. I'm also the CEO and founder of a youth-led nonprofit called Mentor Nations, where we've taught tens of thousands of young people to code in 12 countries. I'm also the partner in a new crypto startup called P3 Crypto, where we are essentially aiming to be the convening force of digital assets, something like the World Economic Forum of digital assets that looks at, private public policy, collaboration and favorable legislation, venture funds, mining operations, innovation activities around the world, etc. So thank you again for having me. I've spent most of the last, almost 10 years working in tech. I'm also an ex-Microsoftie, and again, thank you for having me here today.
Thanks a lot, Melissa. And I wish you the best of luck in your new adventure. All right. So we have also Sasha Kagel, Dr. Sasha Kagel, who has been a great supporter of the AI for Good initiative. So Sasha, tell us about you and also your current works in the healthcare sector and etc. Please.
Hi, everyone. I'm really excited to help put this collaboration between AI for Good and VillCap. I think the program has a huge potential. I am a very passionate about healthcare and entrepreneur. I have been in this space for almost 2 decades and have been part of about a dozen startups. And at this point, I have a portfolio of companies where I'm an investor and shareholder. And my specialty is AI, ML, IoT, and blockchain application to healthcare and digital therapeutics space. I'm excited to be here. Thank you for having me. Looking forward to the pitches.
Great, Sasha, thank you very much. So yeah, let us strengthen our partnership and hopefully we can make many exciting things happen. All right. Okay, last but not least, Mr. John Hunt from the Heartbeam, and he is the Executive VP and the Chief Business Officer at Heartbeam. So hi, John, then tell us about you and your experience in the healthcare field and a bit about maybe a bit of advice for today's startup as a healthcare expert, if any. Please.
Yeah, thanks, Josh. PhD neuroscientist by training, so AI is part of my background from many years ago, but I've been in cardiovascular medicine for 37 years, both in large Fortune 500 companies, but since the late 90s, exclusively in startups. I've had 4 successful exits. I took a company public last year, which I'm the Chief Business Officer of. It's in the telehealth space, so these pitches are very interesting to me, and Sasha brought me into this as a late replacement, but really looking forward to this encounter. Thank you.
Thank you very much, John, for your contribution, even if it was a very last minute, ask. So thanks a lot for your time today. All right, so great. Thanks a lot to all our judges for taking your time. I'm so happy to have such an amazing judge board today. So let me also briefly introduce what are the benefits we prepared for the startup today. So maybe Julian, yeah, please share the screen here. Okay, so you can just move on, just the benefits, please. Yeah, so basically the winner of today's session will be invited to, yeah, here we go. So the winner of this session will be invited to join the IBM Hyperprotect Accelerator, which also is introduced by Adam. So basically this program includes a 3-month business accelerator program and 2 years technical mentorship, and then $120,000 valued cloud credits. So it's a really, really great and interesting opportunity for the winner today. And also the winner will be invited to the Innovation Factory Grand Final Demo Day at the end of this year. And all finalists today will benefit from follow-up mentoring sessions provided by the judges so that they can even move on with the support and advice from our judges. Okay, so, all right. So for those who are watching this session from the neural network, and you can also leave questions in the chat room. And then, well, if we have a little bit of time after the old session, I will deal with some of the questions that you guys raised, and then to the startups today. All right, so now let's move on to today's pitching session. So basically, the pitching rule is the 5 minutes pitch from the startups and 10 minutes Q&A from the judges. So the first team is SergiQ. SergiQ solves complex planning problems involving highly valuable and critical healthcare resources. Using its AI-based planning algorithms, SergiQ designed vertical applications capable of dramatically enhancing any complex resource planning. So we have Ivan Poro, who's the CEO of SergiQ. So Ivan, the floor is yours, and you've got 5 minutes.
Thank you very much, Josh, for the introduction. I will start by sharing my screen, of course, and with a very, very brief video to spice it up. Oh, sorry. So why we put happy people in the end of the video? Because this is something we experienced in person by working with hospitals. We found that many people are stressed and tired because of administrative tasks, actually stealing time to patient care. This is a huge problem. We are going to need more than 12 million people in the healthcare sector by 2030, and this is, of course, a huge business opportunity. The AI space in healthcare optimization has been defined among one of the most interesting and market growing in the next years. How we solve the problem? I mean, you cannot create a model, one does fit all, and bring it to the hospital and say, okay, this is my way, work. Work perfectly starting from tomorrow. This doesn't work. We have a great experience. We know that needs change day by day. So we developed a technology which is able to understand day by day what are the constraints, the preferences, the needs, and maybe also the business targets who might change on a frequent basis. And then the AI solves the problem, allocates all the therapists to the patients, all the patients to the operating theaters, or whatever business sector. I mean, we are fairly general in terms of technology, but specialized, of course, in the healthcare space. We make hospitals more efficient. This is one of the goals in the UN goals. So what mean more efficient? More efficient could be you are going to gain more money. Okay, that's good. But most important, you are going to make an impact on your patients. We measured an impact of more than 10 minutes of care delivered to rehabilitation patients every day by the therapists. The business model is very simple. It's just on-premise or cloud, and we go either directly or with distributors. We have been able to grow of about 40% year over year, and a number of hospitals after the COVID, because of people understood that there is a need of planning tools, and the people cannot continue to do planning over Excel files and things like that. We are also launching our first software as a service solution, and we are expanding the team to support a number of ongoing clients and partnership, especially on the distribution partnerships, because we were able to bring our technology accessible to traditional electronic healthcare vendors, and this is going to drive the growth of the company. We are fundraising in the end. Yes, we are fundraising a small bridge because the business is growing quite quickly. But the most important things in the picture is that we raised that we did that with about 1.1 million, and we achieved amazing goals like getting nominated by General Electric Healthcare, the best growing startups, as you can see in the chart. And compared it to our best competitor, which is Lintas, which received 236 million in 10 years and has been recently bought by Bain Capital at an undisclosed value. This is a great I would say, efficient way to improve healthcare with just 1 million funding in the company. Thank you very much.
Thank you. All right. Okay, so let's move to the Q&A. Okay, so maybe Sasha start, and then Ahmed second, and then John and Melissa. All right, so Sasha, you can start.
Well, thank you for your presentation. I'm completely not questioning the need for your tool, and there is a market need for it. What I'm trying to understand is, what does the success for your customer look like? Are you, do you have a specialty care setting that you focused on, or you work across different workflows and I'm assuming it's a hospital space you are after, not a standalone providers. So can you elaborate a little bit on that?
Yes, I'll tell you a story about the biggest customer we have, which is a network of 16 hospitals. They started by giving us a pilot project, a small pilot on a small site, because they were not able to understand how the people were working. So a coordinator in the physiotherapy space every day has to run over a number of issues in order to make sure that all the patients will receive a given number of minutes of treatments. Otherwise, the patient service will not be reimbursed by the payer. So the problem is that if you miss last minute a therapist or a patient cannot be treated in the gym, you have to rearrange the location where the patient is going to receive the treatment, or maybe an equipment is broken, you have to rearrange all the scheduling. This is a mess. Okay. So the value for them was to understand the resources, the capabilities they have, try to understand if there were enough people to run the job at that given space, and then once the model was okay, they are replicating it to other hospitals. So they're bringing the system to a new hospital, and they discover immediately if they have enough staff to run the service or not, or maybe the people are overwhelmed or maybe underutilized. So these are a kind of side back that we have. In terms of savings, they save more than 20 minutes per day per single physiotherapist. In this organization, this translates to more than 3 million euros per year of potential new business they can generate with that achieved savings on time.
And is your technology scalable across other specialties within?
Yes, yes, this is the key point that we actually, we were aiming at that, but we discovered that immediately because we already scaled the technology to chemotherapy rooms to make sure that there is a constant flow of patients and that enough patients are treated, and we reduced the overbooking in a chemotherapy room at 0, which is really important for patients. And we are also starting working with a company which manufacture and service large equipment like linear accelerator, tomography, and PT and CT scan, because they want to improve the scheduling of the diagnostics in their services. So yes, it's scaled across a number of. We have more than 12 already niche addressed in terms of algorithms.
Thank you.
You're welcome.
Perfect. A great presentation. Let me start saying this. I wish that you maybe spend more time on explaining the problem. I know we're short on time and it's restricted, but I feel like the problem slide is maybe one of the most important, to get the listeners buy-in. But overall, I think it was clear. 2 questions quickly, if you can also elaborate more on the traction, and then maybe a little bit on, I want to say the product demo, or how does it actually work? So if I'm a user of this, how do I interact with the technology?
Sure. Regarding the traction, we are now serving about 20 hospitals across 6-7 different clients. A number of clients of ours are becoming not directly hospitals. So one of the clients is going to be this manufacturing company which produce and service equipments. Another one is Janssen from the Johnson & Johnson company, which is asking for an exclusive agreement for the next 3 years. And another one is Dedalus, who is one of the major healthcare vendors in Europe and nowadays globally. So this traction increased quite a lot during the COVID, 40-50% year over year. It's not I mean, the skyrocketing in the startup space where you want to see 3-digit growth, but considering there were COVID and we are talking with hospitals, it was really relevant to us. Last year we closed at 190k euros revenues, and this year we are already at 100, and with the orders in pipelines to close at 300. So yes, we are fundraising basically to hire more quickly and to pay people more to get them from other companies.
Perfect, great.
Thanks.
Ivan, interesting presentation. Just a quick question: is this a common problem across all types of hospital settings, or is this primarily focused on large tertiary referral centers because they tend to be, in Europe anyway, very large with very high volumes?
Sure. With this question, I will also answer a part of Ahmed's question, which I didn't answer before. Yes, the settings may be different. The typical settings is 100-bed hospitals and above. So a small clinic with 3-4 operating theaters, or maybe a rehabilitation center managing, let's say, 100 patients per day, or with 100 resident patients. It's not just on tertiary care. Our main target is acute hospitals. We actually started with the operating theater optimization, but then we discovered more interest in the rehabilitation space, because I mean, probably in the rehabilitation space, there are more issues in retaining the staff, because physiotherapist is a scarce resources, and in many countries there is a shrink. In the United States, you have up 50% of therapists reporting burnout issues after the COVID. So this is a space where there are less value but higher volumes, and so interesting for us. I don't know if this answered perfectly your question, but yes, valuable resources, acute hospitals identify a pretty large segment of the market.
And one quick last question. So what's the outcome measurement if I'm a hospital administrator or chief of surgery, for example? What are the outcome measurements that your company provides to demonstrate the improvement in efficiency and so on?
I would say in surgical space, operating theater utilization could be increased. In rehabilitation, you can deliver more therapy to your patients, so you get a competitive advantage over others. Or simply speaking, the most raw benefit is that your coordination people, your schedulers, are spending 20 minutes rather than a couple of hours to plan the activities for the next day.
Okay, thank you.
You're welcome.
All right, so I have a question for you regarding your tech stack. I know you spoke a little bit about, kind of moving over to a SaaS solution. Talk to me a little bit about your existing tech stack.
The existing tech stack is completely based on open tools plus some proprietary technology over the open tools. We use an artificial intelligence engine which is not based on machine learning techniques, so we don't need to get a number of data or a lot of data to get out from the clients. Is a technology similar to, if you know the space, like the former IBM Cplex or Robbie, the kind of engine that solve large combinatory problems. So our specialty is in the way we model healthcare problems on top of this engine and are able to provide complex scheduling over 300 procedures in less than 10 seconds. And then the other stack is a typical modern web application and delivered as such. So Kubernetes and the like.
Got it. And then which cloud vendor are you currently working with?
Sorry, which kind of?
cloud vendor, which cloud vendor are you currently working with? Are you running on AWS, Azure, IBM?
Yeah, we use AWS at the moment, but we try to have a cloud independent approach. We have been onboarded in the Google Cloud Platform, and we hope to get into IBM HyperProtect because there are some features here that are typically important for us. I mean, clients are concerned about privacy and doesn't want to move to the cloud because of that. So they don't trust the classic provider. So one of the idea is that get the sensible data on the maybe IBM HyperProtect and then use cheaper clouds for the calculation, anonymous calculation. That could be a strategy.
Understood. I know that'll be music to IBM's ears. So thank you for sharing that.
No problem. Thanks.
Hopefully we have time for one more.
Yeah, just 1 minute, please.
Super quick question. So what's the need of using AI and ML in your technology?
The need is that you have a 10 at 73 combination. I mean, it's it's more complex than a chess game to organize all the possible constraints and preferences that a physiotherapist need to solve, because you have maybe, let's say, 20 therapists, 100 patients, individual care plan for the patients, individual possible location where the patients are, a number of equipments, a number of constraints, and over that, preferences. So maybe a patient may be preferred to be treated by John or Mary. So this creates a huge problem that currently requires hours to be solved by people. And our technology provides the solution in a couple of seconds.
So practically speaking, you play a matchmaker between the patient and the provider, correct?
Between the patient and the healthcare professional or the provider, correct.
Okay,
inside the hospital. Let's say you bring a patient to the operating theater only if you have space in the theater, then intensive care, then the equipment and the beds and whatever. Maybe the patient goes first in the day if has diabetes, whatever.
Got it. Thank you.
Okay, great. Okay, thank you very much, Ivan, for your great presentation. Also, thanks a lot to all the judges for Q&As. As I wish you the best luck. Okay, great. Thanks a lot. All right, so let's move to the next team. So the next team is Diagnosoft from Kenya. So they're a health tech startup using AI machine learning models to diagnose disease from medical imaging scans with high accuracy. So we have Kabu Kiara, who is the CEO of Diagnosoft. So Kabu, stage is yours, and you've got also 5 minutes.
Okay, thank you so much, Josh. Good afternoon from chilly Nairobi. My name is Kabu Kihara, the CEO and co-founder of Diagnosoft Healthcare. We're a health tech startup democratizing access to healthcare in Africa using artificial intelligence. As we speak, there are currently only 4,800 radiologists in Africa. That's for a population of 1.3 billion. 15 countries in Africa have no radiology workforce whatsoever. For the 4,800 radiologists, they have to deal with large caseloads leading to burnout, which leads to high rates of misdiagnosis. This has led to 48% of the population having no access to proper medical attention. So what's our solution to these issues? First, we streamlined the radiology workflow using a radiology information system, as you can see there, making the radiology process efficient. We went a step ahead, automating the radiology diagnosis using machine learning models to diagnose abnormalities in scanned images. And finally, we're offering safe, secure, and easily accessible data storage solutions. So in the last year, we've secured a partnership with Real Hospital to serve as our test site and initial customer. We've built 4 AI models detecting pneumonia, tuberculosis, brain trauma, and brain tumors. We, as founders in the company, have invested $10,000. Our highest model accuracy is at 93% and has very good metrics. We conducted a survey amongst radiologists in Kenya and found that 9 out of 10 radiologists are interested in purchasing our product, validating the problem statement and the solution. We're also in conversation with 8 hospitals to see partnerships with them. Our target market is private and public hospitals and radiology imaging device manufacturers that operate in the African market. The AI in radiology market in Africa is set to reach $3 billion by 2030. We're using a subscription model to generate revenue, licensing the product and AI models to hospitals and manufacturers. We have a goal to occupy 60% of the African AI in radiology market, and we shall achieve this by selling the solution directly to the manufacturer to ensure maximum market penetration. So why Diagnosoft? Because number one, our solution takes 5 seconds to detect an abnormality. It takes a radiologist an average of 30 minutes. Number two, our models are highly accurate, with our best model having 93% accuracy. Number three, our storage solution ensures data is securely stored and is accessible remotely. Number four, our system is fully independent and API enabled. It runs on any infrastructure. And finally, we are Africans solving African problems. Here is the management team. I, Kabu, have 3+ years of experience in project management. I was one of the founding leaders of Kenya's first youth-led business membership organization, the Kenya National Chamber of Commerce and Industry Youth. I've also run other successful ventures in the supplies industry. Jesse, my co-founder, is an accomplished entrepreneur with over 12 years of experience. He's built ventures in the information technology segment and construction and other industries as well. The rest of our team comprises of AI engineers, UX, UI designers, front-end devs, and an in-house radiographer. We have advisors with a wealth of experience in our team as well. Dr. Dio Muzurikwao, a pioneer of AI in healthcare in Africa, is part of our team, and Dr. Patricia Othieno, a radiologist with over 20 years of experience in Kenya's largest hospital, is part of our team as well. And so why choose us? We're a company democratizing healthcare access to underserved communities. Secondly, with the IBM cloud credits, we would be able to ensure maximum data storage safety. And finally, with no clear market leader, now is the moment to win the future of healthcare. I'd like to invite you to join us on this journey as we democratize access to healthcare in Africa. By investing $120,000 of IBM credits and admitting us into the IBM Impact Accelerator. To summarize, we're focusing on ensuring SDG 3 is implemented in the African continent through the use of technology to create positive impact to the bottom of the pyramid communities. And with that, I'd like to thank you and open the floor to any questions.
Yeah, okay, so maybe Ahmed, you can start, and then Sasha.
Perfect, thank you so much. Kabu, really great presentation and pretty clear illustration of the problem and the solution. My only question is if you can walk us more about your plan to scale this, this product.
Okay, so basically we're building AI models to diagnose diseases. So for us, success looks like maximum number of images scanned. So we decided to go through the manufacturer approach. So we're having conversations right now actually with Siemens as well as GE Healthcare in Africa, so that we can ensure that every single machine that's manufactured would have our models within them. So that's how we plan to scale up to ensure that we have complete penetration into the entire African market, as well as other Black people of color countries.
All right, great, thank you.
Yeah, I want to piggyback on Ahmed's question.
Okay.
AI application for radiology is beautiful. And at this point, there is, if any, very little of clinical resistance when you deploy that technology into a clinical setting. However, it has been around, not just the American space, but also European space has quite a bit of competition. I do like the fact that you're looking to go through manufacturers. However, what's not clear to me is just one component. How are you going to stand out in a crowded marketplace?
Thank you, Sasha, for that question. Actually, I'm glad you asked that question because I wanted to elucidate this in my pitch, but I didn't really have the time. So one key thing about AI models that we've just recently come to learn is that there's racial bias when it comes to AI models. So while in the US and in Europe, it's quite all right that they already have this developed technology, here in Africa, we have to be the solution to this problem.
I see.
Yeah, thank you.
Okay, John or Melissa? Yeah, John, please go on.
Yeah, thank you. Very interesting. Obviously, a huge problem when you look at the number of radiologists in the population of Africa. So what sort of footprint do GE and Siemens have in those countries? Because you mentioned that 15 countries have no radiologists. So why those countries wouldn't immediately deploy this solution would be a mystery to me, unless there's no hardware in those countries as well. So have you mapped out where that hardware footprint is in your target countries to start?
So what I would say is that the most prevalent machines are GE and Siemens on the continent, as well as Diagnosoft Medical. So we're having conversations with all three to try and get access into that. One of the major challenges is that while there is access to this hardware, we can't 100% tell in which country there is the infrastructure that we require. So for us, this situation looks like going to the manufacturer because they have that data into the exact countries that they have. So our strategy is to go through first GE directly, and then to Siemens, and then to Diagnosoft. So like in Kenya, we know the information on the ground. Diagnosoft is the largest with about 60% of the market share. They already have a contract with the government to supply all the radiology imaging machinery, and we're in direct communication with them. So we know that we have the impact that we require. Hope that answers your question.
Yeah. I mean, obviously, it will focus where you target opening first, right, or launching. If you've already done a pilot and you've got 8 hospitals that are interested, I think you've got to show that it's scalable across the region, right? So that's really important.
So if you think about the IBM collaboration front, what do you think would be the most helpful for you, from IBM to help you build and scale your business? Obviously, there's the tech component that you have, that you would have access to. What else do you think might be beneficial for you as you grow your business?
I would say, first of all, just the credits themselves. IBM is extremely secure, so that would help us ensure that we have the industry lead in terms of like data storage. I would also say in terms of access to market. So IBM is a well-known organization, and I think we could look through partnerships through that as well.
Okay, thank you.
Yeah, thanks.
Okay, so we have just around 3 minutes. If there is any judge who would like to ask additional questions, yeah, I can give a little bit of time.
Yeah,
yes, John.
I have another question, Kabu. So in talking to different manufacturers, are you intending to license your software to those various manufacturers?
Exactly. We're licensing the product to the manufacturers.
Okay, then, and your business model then is a SaaS model. It's basically a subscription model on how many times your software is utilized.
Exactly, and as well as how many users. So we're offering tailor-made solutions. So let's say a specific manufacturer just wants the models, and that's why we're mentioning the API-enabled ability, so that whatever they need, we're able to still sell the solution to them, license it to them, I mean.
Okay, thank you.
Okay, Cabo, thanks a lot for your great presentation. And so I also enjoyed your pitch. All right, thanks a lot again to our judges for your great question and answers, everything. All right, so let's move to the third team. So third team, Telebionics from the United States, and they're reimagining the future of healthcare according to the introduction to the company. And they are transforming digital health by measuring our daily health, providing AI-driven insights and keeping us connected to our caregivers. So we have, I guess, Chubip. Yeah. So I guess so. Yeah. Sorry for my poor pronunciation. Okay.
It's
so
also a very difficult name.
Yeah. So
Thank you, Josh.
well, no. Yeah. So you have 5 minutes. So the stage is yours, please.
Okay, great. Thank you very much. Hi, everyone. My name is Elias Shbib. I'm the COO and co-founder of Telebionics. We are a California-based medtech innovation company, and we have created a platform that will finally enable the transformation of digital health, providing real-time patient data and allowing more people than ever to access quality healthcare and in turn save lives. Allow me just very briefly, very quick to share with you some of the challenges the healthcare system facing, not only in the US, but also worldwide. You know that, or you might don't know that about half of all American adults have one or more chronic diseases. They call it the silent killer. The age population is as currently today at its highest level in human history. And you know maybe that 20% of American lives in rural area. They represent 66 million people without access to primary health care. And currently, we see a very alarming and growing shortage of clinicians around the world, and is set in the US to hit 124,000 in the next couple of years. And what crazy is that 75% of all our visits to hospital, doctor, emergency room can be done through telehealth or telemedicine, and it's completely unnecessary. Today, there's no solution address all these issues, really to provide home care and health care anywhere effectively. This slide will show you the full picture of our solution, which consists of building blocks. On the left-hand side, you will see our flagship product, RemoSense, which is the world's first all-in-one biosignal device powered by artificial intelligence that can measure 7 different vital signs. It's connected to our secure mobile app, where we leverage edge computing to gather intelligence insight about our patient and allow them to access care from anywhere. All data will be stored on a HIPAA compliance cloud, secured. This will allow our customers to take control of their health data and benefit from AI analytics to empower them with actionable insight about their health condition and to alert them for any abnormality in their state or in their health, that they can take immediate action before it's too late. On the other side, you will see for the healthcare provider, doctors, and caregiver, we offer a powerful real-time patient monitoring and data management platform, supporting the clinicians by the power of AI to give better diagnostic and decision, and keep caregivers always informed about their loved one health condition. The following slide, I will go through how we can, with the platform of RemoSense and with our technology, save lives by applying AI and big data. With RemoSense, we can measure 7 different vital signs: heart rate, blood pressure, heart rate variability, blood oxygenation, 8-lead ECG. It's as good as a 12-lead ECG, what you usually have in the hospital. And on top of that, there's a digital stethoscope. This is everything packed in very compact, accurate, and easy to use medical clinical device that can fit in the palm of your hand. With RemoSense, we will be able to allow patients to collect key vital signs anywhere and instantly send them and relay them to their clinician. This will significantly improve the quality of virtual care and patient outcome. We will be able to free up the bottleneck of the clinician shortage by eliminating unnecessary visits, cutting healthcare costs dramatically, and finally enable the patient to be treated from the comfort of their home. On top of that, what is very important, we will be able to expand access to quality care for unserved and underserved community in the US and worldwide. And we really believe that what make us really very unique and different from any other healthcare company out there or medical device company out there, it's our proprietary algorithm. So what we did, we put the best medical grade sensor into one device combined in our in-house developed algorithm for auto calibration and increasing accuracy. The outcome is superior intelligence medical device. And we are not stopping there because we truly believe that the future of healthcare is the ability to move from reactive to predictive to proactive. And we can achieve this today with the power of AI and big data. Our AI correlation can take the daily measurement and store the data for comparison and tracking. This will help doctors to make better diagnostic decisions while alerting to any change in the patient's state so that they can seek immediate care proactively.
1 minute left.
Okay, I will jump to the next one then. And behind every great innovation is great team. We have really superstar team with many years of experience and proven record delivering transformative and also disruptive product at top company like Apple, Tesla, Fitbit, Amazon, and Microsoft. My partner Woody and I have already 2 successful exits. And in terms of the market, we are focusing on telehealth provider and healthcare providers. This is really around $367 billion target market. And we are bringing really the perfect solution to the market at the perfect time. This remote sense solution can be used by anyone, but we see the biggest impact for people with limited mobility, people with chronic condition, the elder, unserved, underserved community. And imagine just the people in the refugee camp. We will allow them really to access care from wherever they are. Our business model is B2B, focused on telehealth provider, healthcare providers. In terms of growth, we have already LOI for $3 million. This will open for us access to 37 million customers. We have already built a $5 million pipeline through customers. We have them now interested to buy the products and to come on board. And in terms of international growth, we see already today interested customers and distributors from Europe and Asia. Okay, I think it's now less than a minute.
Yeah,
we still have 10 seconds.
Yeah.
I would like. Okay.
Yeah, yes, this is time's up. Thank you. Sorry. So, okay, so maybe some of the elements that you couldn't cover maybe can be covered through the Q&A with judges, I hope. All right,
Sure.
So, yeah, Sasha raised her hand, so you can start, and then, yeah, please go on.
Thank you for your presentation. RPM market is blossoming. COVID is helping, and reimbursement due to COVID is helping a lot. So I see some of the competitive advantages, which is the fact that you have a device. What is not clear to me is, can you elaborate on the device? You list several functionalities of the device, but how, let's say, yes, blood pressure. How would you measure a blood pressure? Is it a third-party device or a device that you displayed here in the presentation?
No, it is our own device. Actually, what we did very unique, we took the best sensor available on the market and we put it in the very compact device, all in one. It means the sensor, we didn't want to really reinvent the wheel and spending years in R&D. We brought already devices, which is medical, clinical grade sensor. I would say sensor, not device, because this is where the secret sauce, that we put the sensor inside, multiple sensor inside one device, which is very compact. It's fit in the palm of your hand.
So
and we do this through light.
The presentation, correct? That's that small device that you presented a picture of?
Yes.
And how do you use it? Let's just go with the blood pressure example. So are you putting this device somewhere like in your wrist area or here, or like how walk through, what's the user experience like?
Yeah, you can imagine the device is literally in the like this size, and with the finger here you can unfortunately I don't have it now, I forgot it in the somewhere. You put here through light, we can measure blood pressure, heart rate, and SpO2 in one click. Then if I need to do the temperature, it's like this. If I need to do the ECG, it's a different sensors on the side where I can go for the ECG. The digital stethoscope is here. It's everything in one compact device, this size approximately.
I love it. Super quickly. So within the reimbursement for RPM in the US, can you walk me through what's your profit margin there? So I understand you present two models. If you're going directly to the hospital, unless you prefer telemedicine channel partnership as your preferred business model.
Yes.
So within your preferred business model, so choose one. Can you tell me what do you guys net?
Yes, we have actually our revenue stream will come from the device sales as one-time sales, but we have also SaaS models where if our customer would like to benefit from the AI prediction and Dr. Melissa, but tomorrow is Dr. Sasha, then he will pay like a monthly fees. This is the additional payment. Now, the beauty about the RPM today in the US, we have already reimbursement code for the device and also for the cloud services. This is covered. This is our preferred, let's say, number one target because it's everything covered from the insurance.
So
now, with the telehealth,
specifically, what's your profit margin for the device within RPM? How much do you net per patient?
Around 40%.
40% of the reimbursement, or 40?
Yes, yeah, 40% from the money. Like if we calculate 3 months.
Okay, so usually it's around $110. Correct me if I'm wrong. So usually it's around $110. So 40% of that. So you net about $50 or so.
Yes, exactly.
And that's so. What does the patient do with the device once the program they are enrolled in is over? Do they ship it back, or do they keep it, or what's happening?
They can ship it back. They can keep it. We prefer to ship it back because the hospital can be like sanitize it and then refurbished to other patient.
Because since you're billing per device, so you can, the more times you reuse it, the better it is for you guys. So I'm just trying to figure out the economics here. Yeah. Okay, thank you very much. I don't want to ask all the questions.
No, but I can assure you we have a very high profit margin. The reason why, because the team have experience also in manufacturing. Really, they spend many years with Apple, with other big company, working on design for manufacturing. It's mean we really know how to bring also with the mass numbers of devices, the price, our cost to a minimum.
Very good. Thank you.
Yeah, so Ahmed and Melissa.
Thank you. 40% profit margin is definitely great. I have like 2 questions on the product. So if you can also like walk us a little bit on the accuracy of the measurements. And then number 2 is you mentioned that you're currently measuring 7 measurements. Are you planning to increase the number in the future? And if so, are you planning to like launch another device to do so?
Yes. Yeah, in terms of accuracy, the sensor we have, it's all medical grade. It's all of the sensor are meeting and exceeding the FDA requirement and exceeding the golden standard. We are very confident about this. And now we just get new relationship with UCLA Health for a equity program, where we will have, again, a medical team supporting us, getting the data and do the clinical trial together with them. We just, while we're talking now, we're planning for this together with the UCLA team.
Great. And then the other question, so are you planning to increase the number of like measurements made by the device? If so, are you launching a new device?
Yeah, we have a very clear roadmap for the next 3-4 years. We are planning to add camera to assist in skin diagnostic. We are planning also discovering some additional sensor in the same device for the glucose level to add it to the device. We did some research R&D in the lab, and we know we can do it. And even extend the capability of the device with the ultrasound.
Very interesting. Thank you.
All right, so I have a couple of quick questions. I think number one, if you could kind of articulate, what do you think makes your device and your company, different compared to your competitive set? Just maybe a couple of 3 high-level bullets would be super.
Yes, we are the only one we can cover all this modality in this compact device, which is very, very small, the only one on the market. We are the only one who is applying really this approach where we will, one of our big advantages that some of the team members, they have been working on correlation of vital signs. There are scientists, medical scientists working on the correlation of vital signs since 15 years. They have already papers to predict certain conditions, list of conditions. And we are the only one who will gather all these sensors, because the first time in the world you can get all this vital sign from a human being at certain state and certain time correlated, then you can build with the future prediction models to really be able to alert the patient, okay, maybe there's here some red flag, seek some immediate care or check what is happening here. And this is a big uniqueness. On top of that, I believe also the high quality of the unit was a very affordable price. We wanted to make it accessible for everyone.
Okay, good, thank you. And then what does your tech stack look like now? Excuse me. And what role do you think IBM could or should play when it comes to your future? Should you develop a collaboration with IBM?
To be honest with you, we had already a meeting while ago with the IBM team, and we are very excited because we see a huge value for what we do in terms of data privacy, security. And now, while we're talking, the team is studying how we are today on AWS platform. They just trying to discover, reading all the material to do the migration. And we are very excited. Hope we can get there also very soon. Definitely, again, also the name, brand, the access to customers, access to resources will be a great value for us.
Mm-hmm. Okay, all right, good, thank you.
Aggie, very interesting presentation, and I applaud you for trying to get 8 vital signs in one device the size of the palm of your hand. Interested in the regulatory pathway for you and which market you're targeting first as a company.
Yes, our major market is US, definitely, and we see a lot of demand actually from the European market. Especially after the new regulation in Germany, you might hear about it, that today the doctor are allowed to prescribe device like our medical device and apps, like they're prescribing medication. Therefore, there's a huge demand also from there. We are planning to go in parallel paths, and we started already for the FDA. We finalized all the documentation. Our QMS, it's done. We are just about like weeks away from the pre-submission for 510K application. We are very confident about the process. The reason why, because as I mentioned before, all the sensor, the FDA, they already know them, they approve them. It is the only things becoming maybe the first one, or not the first one, with so many vital signs or so many sensor in one. We are very confident that within the next 6 months, 8 months, we'll get the approval.
Okay.
And at the same time, we were running with the CE mark for the European market.
Okay, so you're doing CE mark in parallel with a 510K submission as well?
Yes.
Okay. Yeah.
Yes. We have a partner. We work with them. They are really, they don't do anything else besides CMARC and FDA approval.
Right. No, I understand. I just wonder what their counsel was, given you're trying to get 7 or 8 sensors approved simultaneously. I mean, that increases the burden from a clinical standpoint in terms of the validation. So I just wondered how you were handling that. So thank you.
Okay, thank you very much again, Agi, for your excellent presentation. So thanks a lot for all your answers to the questions. So wish you luck. Great. Okay, now let's move to the last team, Heeka Digital Technologies. So Heeka AI platform collects and monitor vital signs of users and for early detection and timely intervention to enhance healthcare outcomes. So we have Moses today, who is the CEO of Heeka Digital Technologies. So Moses, stage is yours, and then you've got 5 minutes too. Moses?
Josh, I've tried to unmute him and request to start video, but it doesn't seem to be working. Ah, there we go.
Right. Okay. Okay, Moses, you're on mute. Can you say something?
Yeah, can you hear me?
Yes. It seems like you're sharing.
Good
Okay,
day
great.
to you all. Depending on your time zone, it's 3 p.m. here. Yeah, so I'm presenting for Heeka Digital Technologies. 50 million people die yearly from non-communicable diseases, and 85% of these deaths are premature between the ages of 30 to 55. So we are working on a solution that will mitigate these premature deaths. Because here in Ghana, we do not have a chronic disease management system, and there are so many barriers to accessing even primary health care, geographical barriers, cost of care, and all that. So we have designed a 3-part solution that will put the health of the patient into their own hands. So basically, we are collecting their vital signs to monitor them remotely and for timely detection and intervention to prevent complications and premature death. So at the moment, we have a manual system whereby they input their vital signs, and we assign a doctor to them and they monitor them every Friday. Whilst we are training our models, we have trained a model in heart diseases, hypertension, diabetes, and stroke. So at the long run, we want to be able to track our clients' vital signs in real time via a medical grade smartwatch, so that the system will run the prediction and be sending them alerts. So for instance, if you're a known hypertensive and your vital signs or your blood pressure is going to the extreme, the system automatically compute that and send you an alert and telling you what to do. So for instance, if you'll be getting stroke, our system should be able to send you an alert that, look, you have a 70 to 80% risk of developing stroke, maybe take a rest or sit down. And that same alert will be sent to your assigned doctor to call you. So during our market research, we realized that if we want to build a standalone solution, it will be very difficult to reach out to our people. That's why we have added the virtual consultation as well, so that even after we are monitoring your condition, you should be able to talk to specialists like cardiologists and all that. So we have that as well. So at the moment, we have a web application, and we have trained the AI models. They are not in production, but at the moment we collect their vital signs manually, and we review them on a weekly basis. So this is just a screenshot of how we take their vital signs and the graphical presentation. So we are targeting persons aged 30 to 70 and those who are hypertensive and persons with cardiovascular diseases, diabetes, and in the future we are adding mental health. Our revenue model is 3 parts. We take 75% commission on remote patient monitoring because 25% goes to the assigned doctor, and we charge 25% commission on all virtual consultations done on our platform. And we have a geolocation-based services as well. So you are able to book for home care service if the patient is bedridden and needs home care services as well. That is also part of our offering. So at the moment, we have 45 patients and we have 75 doctors, health professors registered with us in different specialties, and 11% of that doctors, I think numerically, there are 15 doctors registered with us as well. So we started not quite long. We officially launched in October last year, 2021. And we have a web app in place. So this is our roadmap. So we have the web app in place and the mobile apps are under development. We have trained the AI model already. So it's led with integrating with our user interface. And we are looking at scaling to the entire country in the 4th quarter of this year. So my name is Moses, and I'm the business lead, and our Chief Technology Officer, Dr. Sandov, is a medical doctor and a software developer with over 80 years of experience. Daniel Sesi is our Chief Marketing Officer. He's also a medical student in his clinical year, and our advisor is Dr. Peter Datara. He's the head of nursing department at University of Health and Allied Sciences with research interest in non-communicable diseases. Thank you.
Okay, you can stop screen sharing, and okay, so Ahmed, okay, you're the first. So Moses, you can stop screen sharing. Yeah,
Perfect.
Ahmed, go on, please. Yeah.
Yeah, thank you so much. A great presentation. I might have missed this, but like my question is, how does actually the product work? Like, do you guys provide wearables, for example? How do you measure the vital signs? That's my question.
Okay, so as I indicated earlier, we are looking at integrating with a wearable. So if you have an Apple Watch, we are developing, that is under development at the moment. We want to be able to synchronize that data with our platform so that we can have real-time tracking of your vital signs. So we want to have an inbuilt system that will be sending alerts. So for instance, if your blood pressure is exceeding the normal ranges, our inbuilt app will send you a notification that look, your vital signs are getting way out, see a doctor or take a rest. It will prescribe an action for you. So for instance, in the case of stroke prediction, it will tell you that looking at your vital signs at the moment, you have maybe you're at 70% risk of developing stroke. So maybe sit down or take a rest or stop the activity that you are doing and call your doctor. And that same alert will be sent to your assigned physician to also call you or take action.
Perfect. Maybe like a quick follow-up question. So what if I don't have like an Apple Watch or wearable? Do you guys provide this? And then number 2, how many vital signs does actually Apple Watch measure and report to you guys?
Yeah, so that's a scenario I'm making. At the moment, we are partnering with N1 Plus Intelligence, Shenzhen company in China to manufacture a tailored smartwatch for us so that we can record your sleep pattern, we can record your vital signs, your SOP, and all that. So we want to record most of the things that will combine to be able to track or to tell if you develop a heart disease, a cardio disease, or to be able to predict if there's any impending danger. Yeah.
Got it. Perfect. One last question. What's the timeline for this like manufacturing of wearable? Are you guys like currently in negotiation? Is it like sometime in the future?
Can you take that again?
Yeah, just like what's the roadmap or the timeline of manufacturing these wearables? You said like you're partnering with some manufacturer in China. So what's the timeline? When is it going to be available?
Yes, so we have already made that contacts already. They sent us a sample, but we are not satisfied. So so they said we should give them time. So hopefully in September that should be ready, according to their timeline. Yeah.
Perfect. Thank you.
Okay, Sasha and John.
Thank you for your presentation. Telemedicine and remote patient management, very competitive. Even here during today's presentation, you've heard from a potential competitor. I'm struggling to understand the competitive advantage. You guys are a bit, you lag into the market. The software needs further development. You don't have a device. So from IP perspective too, I think there are some questions to be answered. So perhaps your sales strategy will help you to expand and grow. Can you share a business or maybe technical advantage that I'm struggling to find that would differentiate you in the market space that's quite crowded at this point?
Yeah, so when we did our market research, we realized that we have competitors. So for instance, in Ghana here, we have what we call Lafia. They are the only one who does remote patient monitoring, but they are not recording this in real time. Like my good friend who presented earlier, they are not recording it in real time. So we want to have a wearable that tracks that in real time. And I think that is going to be our competitive advantage.
Okay, thank you.
Yeah, Moses, thank you very much for the presentation. That's a pretty aggressive timeline in terms of rolling out your products within a calendar year, given you started last October. And, you know, I'm in a startup now where I know we're being impacted by supply chain issues because of the COVID pandemic. And I just wonder if you're far enough along that you think you can hit the milestones you've laid out to this group in your presentation. So.
Yeah, so hopefully, so for instance, with regards to the wearable partnership that we are working with, we started that in November last year. So from November last year to September, I think that is enough time for them to finish with that. And with regards to the platform, as I indicated earlier, we have trained 4 models already. We have trained that in diabetes, hypertension, cardiovascular diseases general, and stroke in particular. These 4 models are already trained. What is left is integrating that with the user interface, whereby the manual synchronization can be done. And secondly, the synchronization with the smartwatch.
Okay, thank you. And what's your plan in Ghana to roll this product out? I mean, have you already partnered with hospital centers and stuff in Ghana, or is that the plan? What exactly is your commercial plan?
Yeah, so at the moment, we only have 2 partnerships, one with a local hospital here and a pharmacy. But then we don't want to, we are not offering software as a service. So we want to kind of focus on B2C, but we do have potential partners. So for instance, in a city hospital in Durban, South Africa, Express partnership to use our platform, but we are still looking at how we can work on that. And we also have potential partners in Uganda. There are a group of doctors who are doing home services, and they also express interest in our system, and Botswana as well. And there's also a hospital in Kenya that also expressed interest, but we are still working on how we can work with institutions. So that is not clearly done yet. Yeah.
Okay, thank you.
Okay, so Melissa, perhaps you have questions?
I'm good. Actually, mine got answered. Thank you.
Okay, so if no one has questions, we can close this session. So Moses, thanks a lot again for your presentations, and also thanks a lot to all our judges for the Q&A. So thanks a lot, and I wish you a lot. Great. All right, so now we all finished the pitches from our grade 4 teams. So I will give a little bit of time to our judges to make the final decision to select the winner of today's session. So all the judges, actually my colleagues sent the separate call link, so you guys can go out of the Zoom or just mute and turn off your camera and then connect to the separate call link by using mobile phone or any other device, or even with your laptop, whatever. And then, yeah, so discuss with each other for maybe 3 or 4, maybe even 5 minutes, and come back to this room and then announce the winner. All right. Okay, so while our judges are making a decision, I would like to have a little bit of chat with the finalist list today. So all the teams, you guys can turn on your camera, and then, yeah, let's touch up on several questions. Well, I couldn't find any questions from the audience, but I come up with the several questions that I am also wondering. Perhaps a lot of audience here also will be curious on it. All right, so basically, my first question is, what is the actually biggest barrier or challenges, especially for healthcare startups in using all this, deep tech, including like AI, blockchain? Because as you guys already know, healthcare is not a very easy, business industry compared to just simple, O2O platforms and a game app and the e-commerce, right? So, in your opinion, what are the biggest barriers and challenges, especially as a healthcare startup? Perhaps we can start with Agi.
Yes, sure. I believe the biggest barrier is the regulatory path, because, which is also good because you need to make sure that all the quality management is there, the documentation, the device, everything is secure. In our case, because we're building medical device. The other things definitely is the privacy and the security. As we all might know now, the healthcare data is the most valuable data, and attackers and hackers are after it because it's the most valuable data available. And this is a big concern. We have been lucky that we have a very good team. Myself, my background is cybersecurity since 22 years. We really build everything very robust, very secure, everything military grade encryption. We took care of chipset, the maximum security you can think about. And I hope we will take it now to the next stage also on the terms of the cloud systems with IBM. Also, we will add one more layers of confidence and privacy and security also on what we offer to our customers.
Right, it's privacy and security is definitely big challenges. And so, what about you, Kabu? Especially, basically, the healthcare business in your region is more focused on access to really also underprivileged people, etc., etc. So, do you have any other challenges and barriers that you're facing?
First, I'd like to agree with Agi that actually the main challenge is regulatory differences, especially within different countries. So let's say you're operating in Kenya and you want to sell your product all over Africa, there's a different regulatory landscape when you go to each individual country. The other thing I'd add on top of that is the long lead times. So with healthcare, making a sale, especially for us because we're direct B2G or B2B. So there's long lead times when it comes to that. I would say those are the two major challenges, but I think with any business, there's some challenges, and that's the whole concept of entrepreneurship, to solve problems.
Yeah. What about you, Moses? Especially, you are the youngest team among all these four. So basically, you just started, perhaps, and you got a lot of barriers you are actually trying to overcome. You're mute.
Okay, so I think my sheet to respond to that.
Oh, okay. Good day, everyone. Okay, so most of the challenges we have as a startup in Ghana here has to do with, one, being able to get quality data for the machine learning models we are training, especially because in Ghana, there isn't so much on data collection on the patient we have. So that has been one of the challenges that we have. Most of the time, you have to fall on data that's being gathered from foreign sources like Kaggle.com and all those things. But so we are still putting measures in place to actually organize and gather data for the Ghanaian population so that we will better be able to build the models to predict correctly conditions for the African population and the Black population as well. And the other difficulty we have in Ghana here has to do with how people accept the usage of technology, especially with issues relating to religion and spirituality kind of thing. So people don't really trust that technology would be able to handle some of the basic issues for them. So when they even want to patronize your products, they have to do it with a lot of caution. So the adoption rate in Ghana when it comes to using healthcare products is a challenge that we are trying to be able to overcome and deal with. And the other thing too has to do with the literacy rates or the level of literacy of the general population in Ghana. Well, we have a lot of educated people, but a vast majority of the population have some basic education level or to minimum level, and some of them could not even be able to operate smartphones and all of that. So when they are deploying systems like this that would require the highest level of sophistication for them to be able to use, because they can't be able to find their ways through this mobile or high-level devices, it's difficult for them to be able to do it. So for some of these people, we try to implement the USSDs for them so that without internet, they will be able to access some of these services that we want to provide for them. So these are some of the things. And the major thing for us, of course, is the funding, which we are still trying to gather some funds to be able to roll out what we have. So those are some of the challenges we've had as a young startup in healthcare in Ghana. Thank you.
Well, thanks a lot for your really, extensive explanation, and especially in terms of the literacy issues. It's not something that's just one of you, startups can, solve. It's more like really, nationwide, really education. Like even the government also should be able to intervene, etc. So, all right. Thanks a lot for sharing your insights and thoughts. What about you, Ivan? So you're still here, so it's good to see you, because you said and then you might leave early. But anyway, you've got already some funds from the investors, and you are growing so well. But still, even some startups with a little bit growing, of course, you always meet step-by-step barriers. So for now, what is your biggest challenge as a growing startup, especially in the healthcare sector?
I agree with others in terms of culture. But sometimes people do get some doubt regarding the technology, because they see automation as a way to reduce workforce or overcome jobs which are now done manually. But this can be easily easily worked out by explaining that technology is a companion, not a substitution. The other things also in terms of culture is related to the venture capital and investors community, because when, an investor do expect 3-digit growth and amazing traction from the companies, but healthcare requires validation, requires patience. So there is a need of a culture in the venture capital community, and it's important for us as startups to talk with specialized funds instead of general funds.
Yeah, especially basically the venture capital's nature is just ask startups to let them very quickly exit, quickly make the returns. So obviously, there must be some kind of a little bit of a cultural difference between tech startup, which needs more time to develop the technology in a mature way, but also venture capital's nature wanted to make return as soon as possible. So there's always kind of a tension between them, and I understand. Great, thanks a lot for sharing that at the insights as well. Okay, so maybe we can have a little bit deep dive into several issues that you guys also shared, especially in the section of data. So yeah, as you guys may agree, healthcare data are mostly very sensitive ones. Like the private health information is strongly related to the privacy, but also these data are so super powerful and valuable for digital healthcare services. And also one of our analysts, as they said, the collecting the right data is a very challenging. So what are your thoughts on how to make the right data policy and governance, considering all these privacy and security issues, and how to make the personal health data safe, but also it belongs to the individual, but at the same time usable for various healthcare services. So just share your thoughts on how to build really safe and then healthy, especially healthcare data system. So
I can answer on that quite quickly.
Yes, please.
We are going to get our renewal of the ISO 27001 certification in next week. So even if you are a startup, you have to look at the regulation. In that case, 27,000 is a regulation which is a superset of the GDPR, and it was mandatory for us to follow this path, even if it creates overhead in your business processes. In the end, it creates trust. So the client says, okay, you have processes, you are audited year after year, so you are probably more reliable than a company which is not. So in the end, the suggestion I have for the companies is follow the certification paths, whatever it takes to create a trusted relationships with the customers.
Anyone can add more? Maybe Kabu or Agi?
Yeah, I fully agree with Ivan. It is very important really to seek all kind of certification, the quality management, the ISO certification you're looking for, especially because we're dealing with very critical data, as health data, and therefore you need to give your customer that they are safe. You make your ultimate effort to secure this not one time, not two times, triple and quarter time. And we are lucky that there's now technology where you can be able really to share the data that will be again that you can help really the community with the data you are providing with no track back to you as a person or individual, but still you can help the AI models and the prediction models. What we are also now trying to build, we have a way where we can utilize this information from patient, but without to expose their identity. At the same time, down the road, we really build kind of our vision is to reward the patient, like really that if you participate to this, you will get also rewarded. We don't want that to take data and benefit out of it without that you get rewarded. We have a method where we will be able also to reward our patient, and if we will be able to participate on this data sharing in an anonymous way.
Right. Yeah. Maybe one more thought from one of these two African teams, perhaps.
I'd like to agree with Ivan and Aggie when they talk about regulation. I think that's a really key aspect when it comes to healthcare. And I think that's what really gives the customer full confidence in your product. I'd add on that by saying also by ensuring you've chosen the right architecture in terms of data storage and security, in terms of the policies that you administer within your organization. And then a really key issue and what we're trying to achieve at Diagnosoft is ensuring the patient has full ownership of their data. So if they would want to delete their data, if they feel uncomfortable with having the data there, we would delete that. And also ensuring that the data is anonymized. So the hospitals, while they can have access to the data, they don't have the biodata, the metadata about their name, their age, or the data they don't require. So that's my take on that.
Yeah, great. Thanks a lot for sharing all your thoughts, and they're very interesting. And then also I learned a lot from you guys and thoughts. And then, yeah, great. So it seems like all our judges finalized their decision. So I think they will come back, right? Okay, cool. So did you guys decide who is going to announce the winner? I think who?
Yeah.
Are you? Okay, Sasha, you're right. Okay.
I think it just deferred to me because it's not my first time. Although I think we have some very experienced people on the call to actually in a very specific space where we have chosen a winner. Nevertheless, just a quick note, thank you to all of you for the presentation. I think it was very well articulated. Just for the lack of time, there was some clarification questions, but overall, everyone has done a wonderful job. I think all of you are at the right place. AI for Good in partnership with IBM and Village Capital offer just a great variety of resources, including mentorship and including $120,000 worth of cloud credits. And payroll is always an issue in the startup. So I think 120K worth of cloud could go a long way. Anyways, we had a bit of a debate. We actually had a couple of front runners where we all agreed is that the companies displayed a good use of AI. Now, some of you are further along than the others, and we had a debate, but where we all agreed that today's winner will be Telebionics. We do feel like, although the space you're playing in is crowded, however, the timing is good, and you do have a potential for a competitive advantage once you approve your device, although we're still concerned with the timelines because it might take a bit longer than you anticipate. However, we do believe that, and this is, we strongly, all of us believe that you do seem to have the right management team to execute on the promise to your investors. And we wish you luck. We hope to see the progress here and that's all from me. Maybe the rest of the judges want to add something. Congratulations.
Thank you very much. We are working day and night actually to achieve our vision. We will get there, definitely. Thank you very much. We appreciate it.
Yeah, congratulations again to Agi, and also, yeah, so it's really, really great experience for all of us. And then also, but I also wanted to say all the other 4 teams were really, really great. and then also we are so impressed with all your new novel ideas and passions and also enthusiasm. It's really, really great. All right. So as I mentioned at the beginning, so basically I will make some kind of follow-up arrangement, especially for the additional mentoring session with the judges, and also Telebionics that you are invited to the several, program, the grand final. So all these details will be followed up, right? Okay, good.
Okay.
Congratulations again. And congratulations to all of you guys for wonderful, wonderful work today. So big thanks to all our finalists and juries, and as well as to all the audiences who have been watching this session from the neural network. So for the finalists today, as I mentioned, I will keep in touch with you guys. And also, yeah, and then we are coming in September after some kind of summer break, and then the Innovation Factory will go on. So please keep in touch with us, and then stay tuned, and then good luck to all our teams. And thank you very much. Thank you. Bye-bye.
Thank you. Bye.
Bye-bye.
Bye. Bye-bye. Congratulations, Telebionics.
Thank you.
Thank you for participating in today's AI for Good session. We hope you've learned something new, innovative, and engaging in today's event. We now encourage you to continue the conversation on the live video wall in the neural network. Here you can ask questions, like and comment, share links, complete the poll, connect with interesting profiles, or speak one-on-one using the chat and video function. We invite you to explore the lobby, try the smart matching quiz, visit the virtual exhibits, poster boards, the e-shop, and build your personalized AI for Good program. Let's shape the future of AI for Good.